It can be, definitely depending on what symptoms or side effects that your loved one's having from these said medications. And it can be if they're in a facility, if they're still at home, that's extra work on you or whomever, something that you and your family feel necessary, then it's definitely something that's doable. It's just a process of trying to figure out what puzzle pieces go where.
Hey out there, welcome back to the Nursing Home Abuse Podcast. My name is Rob. I will be your host for this episode. Today we're talking about polypharmacy and how polypharmacy can exacerbate fall risk and what we can do to reduce the risk of falls by reducing polypharmacy. But we're not having that conversation alone. We have the fantastic Jay Durek on to walk us through that process. All right, folks, but first it's time for the Nursing Home Regulation Question of the Week and your opportunity to win the Nursing Home Abuse Podcast mug. And how do you do that? Well, you are going to go to our TikTok. You are going to look for the Question of the Week video. And for this particular week's video, look for the thumbnail that features Sleeping Beauty, the Disney movie Sleeping Beauty. You're going to comment your answer to the question of the week, as well as your favorite classic Disney movie. Now, I don't know what classic means in this instance. Gene, what is classic like from the 40s and 50s or like from the 80s and 90s? I'm not getting an answer. So just your favorite Disney movie itself. But for me, it doesn't matter. Modern, classic, it's Sleeping Beauty. There's just something about the animation of Sleeping Beauty that's different than the other ones that I really, really like. It's a very beautiful film. What else? Yeah, that's it. So comment your favorite Disney movie, cartoon. It's got to be a cartoon. It's got to be animated, I should say. A winner will be selected randomly on TikTok and announced on schenkfirm.com/podcast/giveaway. The mug will be shipped at the end of the month. Good luck, everybody. All right, difficulty level this week's, folks, I'm going to say is extremely easy. Gene really is asleep at the wheel drafting these questions lately. What it is. So if you get this right, then you can go and watch whatever Disney movie you want to. Just take the afternoon off, watch a Disney cartoon. Under 42 CFR 43.10a, which focuses on residents' rights, how must a facility treat each resident? A, according to the nursing home's policies and procedures. B, with respect and dignity in a way that supports the resident's individuality and quality of life. Or C, based primarily on the availability of staff and convenience of care schedules. And that answer is clearly B. The nursing home must treat each resident with respect and dignity in a way that supports that resident's individuality and quality of life. All right, time to get into the meat and potatoes of the episode. As I mentioned, we're talking about polypharmacy and its contribution to falls and how we reduce polypharmacy. But we're not having that conversation alone. We have the fantastic Jay Durek. Jay Durek is a Michigan-born registered nurse with over 16 years of experience in the medical field, including a decade in nursing across hospital and outpatient settings. She is a certified legal forensic nurse consultant and a naturopathic practitioner, blending clinical expertise with a holistic approach. Outside of her professional life, Jay enjoys family time with her childhood sweetheart, their son, and their beloved Mastiff. And we are so happy to have her on the show. Jay, welcome to the show.
Hi, thank you.
I guess the first question is going to be what when we say polypharmacy, what does that mean?
So, polypharmacy in layman's terms is basically being on a bunch of different medications for the same type of thing. And it could be blood pressure medications, it can be, which is most common that I see is a lot of blood pressure medications and things like that. But there are multiple different things that people can be on treating for the same thing.
Sure. So, kind of why would that be a potential risk then? Like why is being on multiple medications at times a problem?
A lot of the times with medications, being treating for the same thing with multiple medications. A lot of seniors don't know what they're on, don't know what they're on it for, don't know how long they're supposed to be taking it. Um, a lot of times prescribers now are just prescribing it and telling people you're going to be on it for the rest of your life. In reality, they don't need to be on some of these medications for the rest of their life. Um, and then also, more than likely, one pill is treating the symptoms of another pill that they're on, caused by another pill that they're on. So they just get stacked on top of each other and on top of each other and on top of each other, which can easily over medicate somebody, especially if the primary prescriber doesn't know everything that that person is taking, which that is very important as well. That includes, everything that's prescribed from multiple doctors, because, everybody's got a specialist somewhere. People take vitamins because they've seen on TV it was a good idea. Um, you know, so it's very good for the main prescriber to know literally everything that people are on, whether it's over the counter vitamins, or any kind of prescribed medication.
Is there any type of medication in your experience that's kind of more linked to causing falls or exacerbating falls than other drugs?
I have a large cardiac background, so I have seen multiple cardiac medications where people are on 4, 5, 6 different blood pressure, heart rate medications, where in reality they really don't need to be on that many. Um, but there are multiple different things. A lot of the times there's antidepressants, anti-anxieties, some types of antihistamines like allergy medications, pain medications, muscle relaxers. And those are a lot of the larger common ones. But in my experience, I've seen a lot with cardiac medications.
So other than the medication list being, a scroll, what are some of the warning signs that a long-term care resident is being over-medicated?
It's really important to kind of know the baseline. So when I say baseline, it's kind of knowing what the person is on an everyday basis before something new comes about, new symptom, new medications, something like that comes about. A lot of the times you'll see they might be getting a little bit more off balance. They might be more sleepy than other times. They might not be sleeping at all because insomnia is one of the side effects that's happening to the over medication. Mood swings. They're usually a generally happy person and they are just running off the rails, angry as all be. It really just depends. And sometimes it's very subtle and sometimes it's very top of the scale. Every person's different and it just kind of depends on each person as well. But a lot of the times it's the dizziness, the confusion, and the sleepiness is a lot of the ones that I've seen.
What are some of the things that we can do to potentially reduce the risk of falls from polypharmacy itself?
So what my family did personally, we recently had put a loved one in a facility. And over the last year or two, we have really drastically looked at their medications and got her down from 10 medications to 5, because she really didn't need to be on all of these different medications. She was on 2 or 3 different blood pressure medications, but she was always dizzy, always off balance. We trialed her off of a couple different ones and she got better. It's always something that families can look at and see if they have any kind of medical background. They can look at all of their medications and see if they have any idea what they are and see if they know why they're on those medications. How long have they been on them? Going to see your prescriber or whatever, you could talk to them about what they really need to be on, for life, and what things you can get rid of, and trial and error which one would be the best one to take somebody off of, because a lot of these medications really aren't forever.
So somebody without a nursing background, how do they do that? Do they just Google your best friend? You take the medication list and start Googling things?
Well, I have a stigma against Dr. Google. It can help, but it can also be a detriment. I would say if you do start Googling things, and I dare say that with a fine tooth comb, if you do start Googling things, just look at the pure basics. What is the medication? What is it for? And maybe look at a couple symptoms and just write that down on a piece of paper next to the name of the medication and like hand it to your family or your loved one's family doctor and be like, hey, is there some stuff? I was looking at these meds. Is there some stuff that we can take off of here that they really don't need? Um, and that's probably as far as into the Googling I would get, because we all know how muddy that can get. But your prescribers, they are busy, but I think they just get so caught up in the day to day that they actually feel refreshed when people actually ask them a question pertaining to something medical. I mean, that's been my experience, actually. So, I mean, they're there to help you. If not the doctors and the nurses at that are working with you. It's always a good to run it by somebody. The worst they can tell you is no, you know.
So you described, at least in some instances, a process of trial and error as you're trying to cull the list of medications, trying to eliminate them. What does that look like? Is it just is it like, hey, we're going to take our loved one off of this for 3 days or a day and like see what happens? What is the trial and error process?
It depends on the medication. Some medications you can stop cold turkey and see how they do. Other medications you kind of have to get like a different dose. So trial and error basically looks different depending on the medication. You can go cold turkey off of some medications. Other medications, like a lot of the antidepressants, anti-anxieties, anticonvulsants, opioids, you can't do that. You might have to talk to your primary doctor, your prescriber, and see if there is something like a lower dose that they could trial for a couple days. I know when I went off of medication recently, I had to wean it down. I was on a higher dose, so I weaned down to the next lower dose for a week, and then I lowered down to the next dose after that, lower, and then I went off of the medication. So you would have to really work closely with your prescriber, depending on what the medication is, to see if it's something that you would have to wean off and what best way to do that. Sometimes when people wean off of antidepressants or anticonvulsants, they have to have another medication added in to help them wean off. So it's just something that you really have to work with your prescriber about.
Yeah, it sounds like it sounds like it could potentially be a process of like 2 steps forwards, 1 step back kind of thing.
Yeah, it can, but in the long run, it might help out quite a bit.
So I guess how long, at least in your experience with your loved one, how long did it take you to get from 10 medications to, I think you said 5? Was that like weeks, months, days, hours?
I mean, it was a couple doctors because she had a couple different specialists. So we took her off some vitamins, seeing how she was doing. And she started doing well. And then with her blood pressure medications, we kind of trialed down a lower dose of, one of her beta blockers, which helps with the heart rate. And her heart rate was staying stable. So we looked at her blood pressure. Did she need to be on the 2 blood pressure medications that she was on? Because the beta blocker can help with the blood pressure, but it's not necessarily specifically for it. So we were checking her blood pressure frequently, and we would lower the dose down. So it took a couple months to get there, but after, I don't know, 3-4 months, we got her off of the 2 blood pressure medications, and she was just on the beta blocker. And to this day, into her facility, I think she is only on 4 prescribed medications and a multivitamin.
It sounds like a lot of love and work goes into that. I mean, it sounds to me like, obviously, if you're in a facility, you're always doing vitals, but it sounds like you're being extra vigilant about vitals, extra vigilant on behavior changes and things like that while you're going through that process?
It can be, yes. Definitely depending on what symptoms or side effects that your loved one's having from these said medications. Um, and it can be if they're in a facility, if they're still at home, that's extra work on you or whomever. But if it's something that is something that you and your family feel necessary, then it's definitely something that's doable. It's just a process of trying to figure out what puzzle pieces go where, basically.
Yeah, that seems to be a reoccurring theme in this podcast is family involvement, and that the more the family is involved, the more the family can help the caregivers, and the better off everybody is, especially the residents. So, very well said. Well, Jay, thank you so much for coming on the show and sharing your knowledge with us today.
Yeah, no problem. Thank you for the invite. It was a pleasure.
Well, folks, I hope you found this episode educational. If you did, please be sure to like and subscribe. Man, I haven't said that in a long time. Like and subscribe wherever you get your podcast from. If you have an idea for somebody that you would like for me to talk to, let me know. If you have an idea for a topic that you would like for me to talk about, let me know that as well. New episodes of the Nursing Home Abuse Podcast come out every single Monday. And with that, folks, we'll see you next time. Thanks for tuning in to the Nursing Home Abuse Podcast. Nothing said on this podcast, either by the host or the guest, should be construed as legal or medical advice, nor is intended to create an attorney-client relationship between the host or their guest and the listener. New episodes for now are available every other Monday on Spotify, Apple Podcasts, or on your favorite podcast app, as well as on YouTube and our website, nursinghomeabusepodcast.com. Again, that's nursinghomeabusepodcast.com. See you next time.